Welcome to the session 4 on framing of questions, that is essay type and short answer type of questions. This session is being taken with the goal to equip the faculty to design essay type and short answer questions. Framing of good quality questions will ensure high quality of student assessments and fair evaluation of clinical reasoning and integration across modules. The objectives of this session would be at the end of this, faculty should be able to construct appropriate structured long essay questions, short notes which include applied aspects, integration module questions, recall, comprehension based of different levels of Bloom's taxonomy, and also the reasoning type of short answer questions. So this session will help you develop and align the questions at different levels of Bloom's taxonomy using appropriate verbs. This is the suggested format for theory paper given by the NMC, which makes our job easier. So they have specified which type of questions should be included in each of the theory paper for 100 marks. MCQ questions will be dealt in the next session. In this session, we will look at examples of long essay questions, short notes, and the reasoning type of questions. So in this set of 6 different types of questions, the applied aspects and integrated module also will appear in the theory paper, and in each of the MBBS phase, each paper should have 2 questions on the integrated modules which are suggested. 6 topics are already suggested by the NMC, so we have to mandatorily include at least 2 questions on these integrated modules. Including all the levels of Bloom's taxonomy, from the lower levels, that is recall, comprehension, to the application and analysis and the evaluation synthesis, all of these can be achieved by including different types of questions as suggested in our university curriculum based on the NMC suggestions. So we have included scenario based MCQs which will include different levels of Bloom's taxonomy, higher as well as lower. Structured long essay question, we prefer to keep it at the level of recall and comprehension, but we can include the higher levels. Short notes which include applied aspects and the integrated modules will definitely come to the higher level of Bloom's taxonomy. And then recall and comprehension based questions, simple questions for the short notes we can include. AETCOM also we can include comprehension and application based. And the reasoning type of short questions are again on the higher level, including application, analysis and evaluation. So this is the number of questions and marks per question given in our curriculum. If there is a doubt on whether the question assesses which levels of Bloom taxonomy, a simple question can be asked. If that particular question assesses a rote memory or isolated facts, some guidelines given in the textbook, based on that, if there is a question in which the student has to just simply recall the facts and answer, it is on the lower levels of Bloom's taxonomy, recall based. If a particular question that is asked in the question paper assesses the student's ability to analyze the problem, reach to a conclusions, choose a course of action, or synthesize his own answer, then it belongs to the higher levels of Bloom's taxonomy, which is application of knowledge and synthesis. Now coming to each one of us have already constructed essay type questions in different exams. We will just go through some of the guidelines on how to construct an effective essay question. Clearly define the intended learning outcome to be assessed by the item, that is by the question, what you expect the learning outcome of the student to be assessed in that particular question. Match the question to the specific learning objective as given in the different subjects, and also to the Bloom's taxonomy, which level you want to assess in this question. Clearly define the task and situate the task in a problem situation. Present a reasonable task. Routinely seen examples in clinical practice, those kind of questions can be taken up here. And give a reasonable task, don't give a very lengthy question which the student will not be able to finish in the stipulated time. State the criteria for grading. The marks distribution, if the question includes subparts, then the grading, the marks for each of the sub question should be mentioned. Phrase the question in a simple, clear and straightforward language so as to avoid ambiguity. Avoid words like what do you think, what is your opinion in any of the essay questions. Instead, use specific verbs as we have discussed in the previous sessions at different levels of Bloom's taxonomy. What verbs can you use to frame the questions? Enlist, name, enumerate, define, compare and contrast. So all these verbs have to be used in framing the questions. Now coming to the examples of long essay questions. This is an example complication of diabetes mellitus given in one of the question papers for 10 marks for a undergraduate medicine paper. So now the problem with this question is it is ineffective. You can expect generalized responses from the students. They can write on any one of the complications of diabetes, or they may include all the complications of diabetes mellitus. So scoring will be unreliable, and it is a threat to validity of assessment. So now here, even if the student answers one complication, you have to give them marks because you have not specified what are you expecting from this question. So instead of this is an example for MBBS phase 1. Explain the role of insulin in regulation of blood glucose level and how its deficiency leads to hyperglycemia. Tabulate the diagnostic criteria for diabetes mellitus as per WHO or ADA. Now this include questions on different Bloom's taxonomy. So explaining the role of insulin is again the facts that he has studied from the textbook he has to write. How its deficiency leads to hyperglycemia, it is at the little higher level. So he has to understand the role and then he has to explain in his own way how he has understood this topic. Tabulating the criteria for diagnosis, again it's a factual knowledge, so it comes at the lower level of Bloom's taxonomy. So different levels are being assessed and it is very specific. So the student exactly knows what is expected of him, what he has to answer in the paper, and the marking also becomes easier. For MBBS 2, you can take the example of enumerate the classes of oral and injectable anti-diabetic drugs, explain their mechanism of action, indication, contraindications and adverse effects. This is also very specifically asked, what class of drugs and what is expected from the students. Now for the phase 3 MBBS, you can include a question on diabetes mellitus on the same topic, like enumerate the acute and chronic complications of diabetes mellitus. Describe the clinical features, diagnosis and management of a patient presenting with diabetic ketoacidosis. Now this kind of questions will provide the students to respond openly to an essay type question. Now in essay type of questions, we also expect the student to express how much in depth he has understood about that topic. So instead of making it very subjective or very objective, we will try to make the essay questions more subjective to understand the depth of understanding of that student. This type of questions will also allow original responses, and each student may give a varied response pattern. He may write it in an essay, he may write it in the form of a flow chart, he may write it in the form of points or a concept. He can express his own way of answering this kind of questions. And only one thing we need is, while we are correcting the answers of essay questions, we have to judge or mark, and this is a more subjective judgment as compared to the MCQs where it is very objective. Another example of long essay question, we can also include a modified long essay question where we can present a typical problem faced in a daily practice. So this will become a case unit based or a simple case based question with sub questions. This kind of questions will cover higher cognitive levels and develop higher problem solving skills of the students can be assessed. For example, for first year students, a modified long essay question would be presenting a case like a 55-year-old man presents with a crushing chest pain radiating to his jaw and left shoulder On investigation, he is found to have an occlusion of the proximal left anterior descending artery. So now here we are not asking for the diagnosis of the disease, because as a first year MBBS student, he will not be exposed to all the clinical cases and the disease diagnosis. But here we want to know the basic concepts related to that disease. So we are giving him a brief symptoms and signs of the patient along with direct questions on his understanding of this disease, how this disease is affecting the circulation. So which segments of the heart are most likely to suffer infarction in this scenario? Delineate the anatomical course of the LAD including its principle. This is again a factual based question which he has learned in anatomy, and he has to just present or answer how much he has understood in this paper. How coronary collateral circulation can modify the size of impact. Now this is again at a Bloom's higher taxonomy level. So he has to understand if that was blocked and if collateral circulation would be there, then how would it impact the case. Then also another question, explain why subendocardial region of the myocardium is especially vulnerable to infarction. Again, it is on his application of knowledge based on what basic concepts in anatomy and physiology he has learned. So this also will include integration across different subjects. Another example for this kind of question in general medicine for the final year students would be a 65-year-old man with long-standing type 2 diabetes mellitus and chronic kidney disease presents with an acute ST segment elevation myocardial infarction, and his angiography report is also given showing a stenosis of 95% and of the proximal LAD. He is stable and eligible for revascularization. This is the brief case scenario given. And the questions framed for this case compare and contrast the two main reperfusion strategies for STEMI. So both these reperfusion or revascularization strategies which are given in the textbook, both are given. So he has to compare which one is better for this patient and what are the pros and cons of both of these interventions in this case of patient. So discuss which is preferable in this patient, giving reasons. And after successful management, second, preventive measures. What should be given? Pharmacotherapy as well as lifestyle changes. What can be given to this patient and why it has to be instituted. So reasoning as well as application. Actually this question is based on a very high level because he has to analyze, he has to apply his knowledge, and he has also to synthesize a management plan for this kind of patient. Next, coming to the short notes on the application based and on the integration modules, which allow demonstration of knowledge, reflect the curricular integration and also the clinical reasoning from the student. So all these aspects we are going to assess using these kind of questions. Example for first year MBBS in this diabetes module would be a brief case scenario is given along with his lab reports. So the question given is justify the diagnosis with interpretation of lab reports. Since we already tell them the diagnosis of diabetes, the criteria for diagnosis in the first year, we can ask them based on that, apply his knowledge to diagnose the disease and interpret the lab reports, because already we have, for the common analytes, the normal reference ranges are being taught in the first year. Describe the metabolic derangements involved in carbohydrate and lipid metabolism and explain the basis of ketoacidosis. So the application of his knowledge to the core concepts taught in biochemistry, he has to know the reasoning why, what changes have taken place in this disease at the cellular or the molecular level. So that is what we expect him to understand in the first MBBS, and so the questions are framed in this way. So this we have seen that it's application based. It also elicits higher order thinking skills. The question is clear, structured, and the use of verbs also is appropriate. Marking has been broken down and given. So this is how we expect to frame a question based on the integrated module and the application based questions. So now an example for the second year MBBS pathology. Here we have just given a very brief case scenario, not a detailed scenario. So two patients presenting with anemia, both have hemoglobin of 8, but their indices are different. One has MCV of 55 and another one has 85, and also the iron and ferritin levels are given. So based on this, the question asked is analyze and differentiate between iron deficiency anemia and anemia of chronic disease on these findings. So the student, already a case scenario with a diagnosis is given. He just has to analyze why though the hemoglobin is 8 in both the patients, based on the indices, what differentiates between iron deficiency and anemia of chronic disease. Based on these findings, what he has understood, he has to explain. Now, our final year MBBS in obstetrics and gynecology, an applied question on anemia can be asked presenting a brief case scenario. So this 25-year-old pregnant woman in the second trimester comes with a hemoglobin 9.2 and it is a microcytic hypopyremic anemia. So now the student has to apply whatever knowledge he has learned on anemia in pregnancy, whatever he has studied in the clinical postings as well as the theory textbooks. He has to create a stepwise antenatal management plan for anemia, justifying his approach, his or her approach, based on the clinical guidelines which has been taught in the clinical postings. So this will again assess the higher levels in the Bloom's taxonomy. Another example of applied question is, now theory he must have learned about the nutrition in the community medicine. Now you can give a question on applied aspect of the nutrition to formulate a balanced diet for a 70 kg adult man leading a sedentary lifestyle in terms of proximate principles of the diet. So it's a very clear question. He knows what he has to write in this question based on what he has learned in theory. Next set of questions, again 5 markers, short notes. These are simple recall based questions. These are a few examples that are given, which you can directly ask based on the facts, based on the guidelines given in the textbooks, what he has to know and answer clearly in the paper. So describe the phases of the cardiac cycle and correlate them with the coronary blood flow in left ventricle. This is a simple physiology question. He just has to, whatever he has read in the textbook, he has to understand and he has to write in the paper. Describe the structure and composition of extracellular matrix. Again, a direct question in biochemistry. Outline the treatment of status epilepticus in an adult, direct question in medicine. Compare and contrast the use of ramipril and amlodipine in treatment of hypertension against a simple and direct question based on comprehension and maybe a little higher level in the Bloom's taxonomy to analyze two different types of antihypertensives and write the answer. So this question must be clearly stated, and if you want to make a higher level in the same question, you can include a case scenario and modify it to the higher level. We also have to include a question on AETCOM for 5 marks in each of the theory paper. So this kind of question, you can decide whether you want to ask a direct question, or this also you can make a higher level question. So examples would be a simple question, describe the roles of an Indian medical graduate, which we do it in the first year MBBS. We can directly give the question and he has to just write down the facts, what he has learned, recall and write it. Enumerate the rights of the patient in a hospital setting is also a direct question. A higher level can be framed in such a way. A woman requests the doctor not to inform her husband that he has terminal illness and she is concerned about his emotional health. So now here the student has to understand what he has to do in such a situation, which ethical principles are involved here and what the doctor can decide based on the request from her, from the patient's wife. So he has to think over and answer this question. Coming to the last set of questions, the short answer questions of 3 marks, which are reasoning type. This type of questions will assess problem solving and logical justification, which are again at the higher level of Bloom's taxonomy. So examples for these questions for the first year MBBS would be, What is the biochemical basis of neurological features in B12 deficiency? Now, vitamin B12 as theory topic, its sources, functions we would have explained, and along with what deficiency manifestations the vitamin B12 causes. Now, what is the biochemical basis of neurological features? He has to understand why B12 deficiency causes neurological symptoms and explain the biochemical basis of that. The anatomy question would be fracture of surgical neck of humerus. Why does it cause wrist drop? So he should know the anatomy of the surgical neck of humerus, what nerve passes and what are the relations, and then answer this questions why it causes wrist drop. This nerve supply of this he has to understand before answering this question. So the second year MBBS question example would be, why does anemia of chronic disease often have a normal or high ferritin level despite low hemoglobin? Again, the Bloom's higher level of taxonomy, you'll have to, he has to know what changes in the iron metabolism occur in chronic disease. For a final year student, we can ask questions like why adrenaline is preferred medication in anaphylactic shock. So he has to know what is the action of adrenaline and what happens in anaphylactic shock and correlate those things and answer this question. Or an example is, why is magnesium sulfate the drug of choice in seizure prevention in eclampsia? So such reasoning type of questions, these are just examples which we have given. You can even think of different types of questions to assess different application based, analysis based questions of for the students in day-to-day, what clinical discussions happen. Based on that, you can frame the questions at any level of Bloom's taxonomy based on the criteria stated in the university question theory question pattern and include those questions. To summarize, the effective framing of essay and short answer questions in medical education moves beyond simple recall to assess students' ability to apply, analyze and synthesize the knowledge in a clinical context given. So a good assessment question is based on a blueprint which we have explained in the previous sessions, and the question should also align with specific learning objectives as stated in the NMC curriculum and focuses on common or serious clinical problems as discussed in the clinical postings. So with this, I would like to end the session that if we start preparing good quality questions and start including them in regular assessments for the students, probably at least they will realize what is expected from them, what kind of questions they will have to answer. So that makes them, or maybe that will initiate better reading and better understanding of the subject for the students, as we know that assessment drives learning. So through good quality assessments, we can motivate the students to learn medicine in a better way. Thank you.